Hello, everybody, and welcome back. I hope you enjoyed those poster sessions and maybe had some chance to fill up your coffee or get a lunch for today. I did have a phenomenal lineup, and I just hope you are ready to sink into this. This next session, like yesterday's Better Together reflections on building strong partnerships in research sessions, parts 3 and 4 will highlight the interplay of researchers, partners, and community organizations that strengthen implementation and lead to synergistic impacts for projects and their communities. This session in particular is titled Research Provider Partnerships in Scaling Autism-related Socio-Emotional Supports in the Community. There are major gaps in our knowledge that are preventing the successful implementation of mental health supports for children with autism in Canada. We focused this session on a specific socio-emotional group intervention called the Secret Agent Society. I love that, which has been used in research contexts and is delivered in communities in many countries. While efficacy trials exist, questions remain about program implementation by publicly funded community-based service providers and how this work can be integrated within a research context. Our discussions with partners indicate an ongoing need to ensure that the intervention is helpful, to some degree really document the fidelity and the kinds of adaptations that occur, and to understand the degree of acceptability of the intervention for staff and clients alike. The research community partnership involved 7 agencies from the Greater Toronto Hamilton area. Creating research practice partnerships are so key to understanding the real world realities of scaling up, implementing, and evaluating interventions in our community. So today we have Dr. Jonathan Weiss, who is a clinical psychologist and professor in the Department of Psychology at York University. He holds a Tier 2 York Research Chair in Autism and Neurodevelopmental Disability Mental Health and is the director of Lamar Center for Child and Youth Research. Dr. Weiss, we cannot wait to hear all of the innovations in this amazing program. Take it away.
Thanks so much, Jody, and for that fantastic introduction to set the stage for why I'm so passionate about this kind of research. So thankful that KBHN has funded this kind of work. As you noted, uh, developing mental health supports is really important, but doing so in a community and understanding how it gets implemented is really critical. And that's what today's panel will really be about. I'll be moderating this panel. Um, uh, um, and I'll be introducing our kind of partners, our panel shortly. But before doing so, I'm hoping that our audience can take a few moments to watch a video that shares a bit more about the Secret Agent Society, the intervention that we evaluated in the community, to get a sense about what it looks like, so we can spend the rest of the time in the panel talking about what the partnership looks like. We've long known that autistic youth need support to help them with social situations and with managing emotional triggers. Up to 70% of autistic youth have noted experiences of high levels of internalizing and externalizing conditions, difficulties managing things like anxiety or anger or sadness. And while we want to address environments, we also want to make sure that we provide youth and parents with tools that they can use when they're faced with these kinds of triggers. The literature gives us a lot of opportunities to provide this kind of support, primarily through cognitive behavioral approaches to building this toolkit. Most of this empirical support comes from tightly controlled clinical trials, and less is known about how these kinds of interventions, these programs, work in the community, in the real world, especially in situations like COVID, or in considering how these programs are scaled up across community agencies with their own cultures, their own processes, and their own staff. So we wanted to address that gap in this research.
What is known about interventions often comes from randomized controlled trials, such as the Junior Detective Training Program by Dr. Renee Beaumont, published in 2008, which is a small group social skills program for autistic youth that showed meaningful changes and has since been changed to be called the Secret Agent Society Program. SAS Small Group Program is an espionage themed program that consists of child club meetings, parent group meetings, teacher information sessions, and teacher tip sheets, paired with real life practice missions and games, and a skill tracker system to monitor and reward skill development across both home and school. The SAS program empowers children to develop skills in emotion recognition, emotion regulation, social skills, and problem solving. At Lakeridge Community Support Services and other service providers like us, we've been so grateful to have this opportunity to participate in York's research project so that we can help inform our evidence base and especially to learn from each other.
With support from the Kids Brain Health Network, we implemented a community-based evaluation of the group-based Secret Agent Society program for autistic children and their families. We were able to connect with 7 community-based autism service providers, just like Lakeridge, all based in Southern Ontario, to discuss the project and the implementation plan. As part of the research team, we spoke with the organization's leadership and clinical leads to better understand their organizational structure and to prepare for the implementation of a research-based intervention into their existing services. We designed unique research protocols for each provider and worked with their therapy team to ensure smooth process for training lead therapists and recruitment of participants. We were also mindful to keep the plan as flexible and accommodating as possible due to COVID-19. In total, we enrolled 84 parent-child dyads across all agencies and were able to collect data about the child and parents' social functioning, mental health, and overall well-being before, after, and 3 months after participating in the program.
As a Secret Agent Society therapist, our goal is to bridge what the cadets learn from the SAS digital headquarters to their everyday life. Getting the buy-in from children to be motivated to learn about self-regulation strategies and social skills is one of the biggest challenges for family and clinician. The SAS curriculum not only captures the interests of the cadets using the spy theme in video games, this evidence-based manual teaches many skills that are common challenges for children with the diagnosis of autism spectrum disorder, such as recognizing one's emotion, coping strategy, problem solving, and other essential social skills. As part of the York University research trial, our agency ran 3 groups for 17 families, all through telepractice. The groups were very successful, with one of the families reporting that the training in emotion recognition, relaxation, and social skills delivered by wonderful facilitators has benefited him in his day-to-day life and will be a lifelong reference in times of stress and anxiety. I would definitely recommend these programs to others with similar needs.
So hopefully that gives everybody who's watching a sense of a bit about what the intervention actually looks like. Our panel, our discussion today is less about the actual training of how to do SAS and more about a discussion about how we partner together to reach 84 families across so many agencies and the different experiences that we have in our different roles in doing so. I'll be asking a number of different questions over to our panelists, and this is an opportunity now for me to introduce our panelists who you just saw a bit of in the video, and then we'll kind of get started with those questions. Okay, first, we have Dr. Vivian Lee, who completed her postdoctoral fellowship with me, actually, at York University. During that time, she facilitated the research community partnership that you're hearing about today and led the implementation of this project. She's now an assistant professor in the Department of Psychology at Carleton University, and her work focuses on examining the facilitators and barriers to healthy emotional development and mental health in autistic children and youth, as well as parental and family well-being. We also have with us Melissa Lagree, who's a board-certified behavior analyst with over 20 years of experience contributing in the field of disability services. She works as a clinical manager at Lakeridge Community Support Services. She's a verified course sequence instructor in the Masters of Applied Disability Studies program at Brock University, and a senior consultant to the Secret Agent, the Social Skills Training Institute, who distributes the Secret Agent Society program. As the clinical lead for SAS at Lakeridge and senior SAS consultant, her passion for SAS, which is backed by over 10 years of experience running the program, is welcomed in our kind of intervention trial and notable. As well, lastly but not least, we have Carmen Chu, who is a behavior therapist at Carey's Place Autism Services. She earned her master's in applied behavior analysis and autism from Russell Sage College and obtained her BCBA credential in 2019. Since 2014, Carmen has been supporting adults, children, and youth with autism using social skills groups and on a one-to-one basis, both in person and through telepractice. So thank you so much, our panel, for being here. Let's jump into some of these questions. So I want to start by asking you each about what brought you to this project. Vivian, let's start with you. I'm wondering if you could describe your role a bit in the project, how you got started, and from your experience, what did it take to get set up in this study in terms of the planning phases of doing so?
Thanks, Jonathan, and thanks to KBHN for inviting us to talk about this research and community-based partnership. So I was mainly the coordinator for the research program and in charge of establishing that research community relationship with our community-based agencies. And so within the lab, the first thing I did was establish a team of graduate students and research assistants who would be assisting us in data collection and making sure that we were all on the same page. But importantly, one of my main roles was to establish a strong working relationship with our community providers. And so that included speaking with the clinical leads and meeting with the different therapists to really get an understanding of how each agency worked. That was really important for us because we didn't want to assume that everybody was the same. We wanted to know how different families would be recruited, what their screening process was like, how they were going to implement and actually deliver the program. And these were really important to us because then we could start thinking about how to implement a research process or the research program into their existing services. We wanted to make sure that we weren't interfering with their work, but was actually complementing and supporting them while they were delivering SAS.
That's fantastic. Thanks, Vivian. The notion of really taking a step back from implementing the research to understanding what's going to work for the community really matters. Now, Melissa, when you were approached by us to be involved in this project, what first came to mind as a lead facilitator and a decision maker, in considering continuing to deliver the SAS within this kind of research context? What were you looking for when we came knocking?
Well, when there's opportunities to expand knowledge while supporting on the ground improvements for families who access services that are available, I'm always keen to join in. But there needs to be value for the organization I'm working for, as well as our teams and the families. So I get really excited about research, but I also need to balance that with where is the value. So this project in particular, the topic of community acceptability was really interesting to me, and a fresh perspective on looking at some more knowledge base that we can add to the evidence that's already there to address this gap in the SAS evidence-based literature, but also social skills groups as a whole, which is really relevant, especially in Ontario, as we are challenging ourselves with adapting to different service models because our funding sources change over time depending on governments and such. So from a clinical oversight lens, I was really looking at how this was a cool opportunity for us to inform our current practices at Lakeridge, but also to build capacity to serve more families. We typically do hold a pretty extensive wait list for secret agent there. And by doing this, we were able to build capacity to reach more families by training more staff and expanding our staff skill base. So when first approached, the value was really clear to me as we were going to be able to train more more staff, reach more families, and I was really excited to be able to contribute to helping this get off the ground, to connect with you all and help set forward some practical next steps for the providers.
And Melissa, you were already involved with Secret Agent before we came knocking. This was really more about the research kind of piece, but you had lots of experience there. Carmen, you are a behavior therapist who delivered SAS as part of this research project, but you were newer to this intervention as well as to the idea of the research project Melissa was, than say Melissa when it came to the actual program. So I'm hoping you could tell our audience here how you first got involved in the project and some of the things you were looking for and what kind of drew you to it as well.
Great. Thank you, Jonathan. Thank you, everyone. So our agency, as Jonathan mentioned, did not deliver SAS prior to joining this research project. So we remember it was one team meeting. Our clinical supervisor just said, hey, we got this partnering opportunity with York University to teach Secret Agent Society. We all got super excited, just knowing that, you know what, we got to learn something new. That was how we got involved. And of course, a lot of us advocated, be like, can we be part of the team? So luckily, two of my teammates and I were selected to participate in this project, which lead us to more than just learn about a amazing curriculum. It also lead us to talking to you guys right now in the panel. So we're really grateful for this opportunity. So I remember last year in the summer, it was the first time we met Vivian. It was in a Zoom call, I believe, that it was, she was telling us about all this checklist and recruitment process and all this focus group that we have to do. And it was very daunting in the beginning because remember, last summer is only a few months into the pandemic. So it was kind of nerve-wracking being like, we have to deliver social skills group online and doing all this research protocol. Oh my goodness, what's gonna happen? But the good thing is that it actually worked out very well. And as Vivian was saying earlier, she and her team, the whole team, did a great job keeping a close connection with us. So we were feeling supported throughout the way.
So what kind of, just to reflect overall, imagine kind of what our panelists have just described, but times 7, because not only is this a one linkage with Lakeridge or one linkage with Carrie's Place, but there were leads at each agency that were taking that kind of perspective, and multiple facilitators or therapists at each agency who were part of those agency-specific team meetings that took place where people said, hey, we have this opportunity to partner. So multiple conversations at the same time have to happen to share, to kind of work through, because everybody can have different responses to those first kind of bids. I'd like to turn the next set of questions over to, and they're big questions, so they can take some time here, to all of you. It's really the point of discussion. I'm sure people are very curious about what some of the benefits, from your perspective, what some of the benefits were and the challenges are or were in doing, kind of implementing this partnership together of bridging the research and community contexts. So it takes some time to kind of think about both of those, and I'm curious if you could comment for us on them, the benefits and the challenges.
I would love to jump in first because I actually ended the last bit about a benefit because I don't remember how many times I called Vivian in the middle of the day. So it would be having a conversation with my supervisor, and she's like, "How is it going with the research? How is it going with SAS?" And then I'm like, "I don't know. I don't have an answer for that question." So we called Vivian, and the whole team was super responsive. And that also goes for SAS, Secret Agent Society. Sometimes we email the Australia also, and also email Melissa, and they were super responsive. So that's definitely one benefit for working as in collaboration with other agency and a community partner. We got the support from each other, and everyone were amazing at communicating. And I don't know, Vivian, you might speak a little bit more to this. Remember how we have to submit the checklist to you guys? That is part of for the end. So when we're done with every program, we submit do a kind of checklist to York University. And then it was super helpful because it actually increased our treatment adherence. And also we felt more responsible to not only the parents, but also the partners.
Yes. Yeah. No. And I think that
with the research opportunity, with the research protocol, one of the things that we did was focus groups with our therapists. And so with each of the agencies, after they delivered that first set of programs to their kids, we were able to ask them what worked, what didn't work, what were some barriers. And so then we had a whole list of lessons learned that we were able to then share with the other agencies that were part of the research program. So in a way, we kind of created this informal community of practice between all of these different agencies that were delivering the program, which then I think helped, as you were saying, Carmen, in your own delivery, right? So taking information and lessons learned from one agency and being able to then communicate that to others and to help them as they were continuing on delivering the program in the community. So I thought that was a huge benefit for us and something that was probably unique to how we set it up in terms of the research program with the community.
And I would add from an oversight perspective, but also from having run SAS for so many years, there's always more to learn, and to be able to join this community of practice, which that's exactly what has happened, is we've been able to network and build connections that have continued past the project, is a really awesome benefit for us to learn from different ways to approach the same type of program that can really best meet the needs of the families we serve, especially during a pandemic, and being able to navigate this really intense stretch of our scope of competence everyone has had to do with learning to deliver via telehealth. As from a BCBA perspective, the amount of workshops we were doing and trainings we were doing was a lot. But specifically to this project, the research team, Vivian, hats off to you all. Really, so much support, and to be able to learn through that process is great. One of the other benefits I'd like to mention from a program coordination perspective is a program like this is pretty resource intensive, and it can be tricky for organizations to first onboard doing a program like this without really having experienced the value of it yet, because the outcomes that come out of a program like this are pretty immediate, but then also last beyond the program's completion. But to continue to leverage support from our board of directors and leadership to the value of continuing to support ongoing implementation and training of our staff to deliver it the best way we can. One of the challenges that we experienced, though, especially going back to that networking, was related just to the state of things in Ontario, and coming from a funded organization, we were really new to that private sector, and that working collaboratively with other organizations who were potentially our competitors was an interesting spin on this project that we were able to learn through, and supported with yourselves too, in being able to navigate that. And with that added responsibility of being committed to the research, that was a challenge with having to allot additional resources to support some of the partners from my perspective, but also a really great opportunity. With that pandemic piece added in there, I think that added responsibility to the research really helped drive us to continue to push forward, to learn quickly, to serve these families who are sitting there waiting for help, and they themselves being completely uprooted, and so that was really great, and really synergized and gave energy to our team to take this as a really awesome opportunity. The program is fun for the facilitators as well. Carmen, you can attest to that.
Yes.
So it's fun for the families, the kids, and the people delivering it.
Yeah, this program again, like because it's our first time running, we have a lot of experience running different types of social skills program, but specifically to SAS, this is brand new for us. But the awesome thing about the theme was super helpful in helping us to make the session very interactive, and it's able to make it even fun for the clients, because like who wants to stare at the screen for another 1.5 hours a week after doing online school for so long, right? Another benefit that actually what Melissa said reminded me of is that because we were able to get the funding to run the groups, so we're able to run this group for free in our in for our agency under this research project. So the good thing is that I don't know about you guys, like as a facilitator, when I just learn a curriculum and delivering it for the first time, it's actually part of training. There's a lot of things, there's a lot of kinks that I need to figure out, but I feel so much more ethically responsible for the family. Also, that I feel like even though I am practicing on them, but because we're able to deliver this for free, we feel more comfortable and have the flexibility to do so.
Yeah, just to say that for people in the audience that might not know, in Ontario there's been this shift towards fee for service requirements that many publicly funded agencies have had to implement or consider, and everybody's doing it in their own way. So when Melissa and Carmen were talking about the downloading some of those costs or reducing those costs on families, part of the benefit here is that we could use some of our resources to support the onboarding of new facilitators and staff, reduce some of those pressures, not only on agencies, but also ultimately on the families who are participating in these projects. And then the other piece is along the side of, so different provinces might have different funding mechanisms when it comes to those, but certainly within our context, that was part of the value of being able to bring this forward, is to say we can support some of that risk of taking on a new intervention. And the other thing that I loved hearing was that the research side could almost serve as the network hub, so to speak, where information's coming in from many sources, but then it gets distributed to many. And even though there might not be direct relationships between agencies, this becomes a place where information can be compiled and collated, integrated, and then distributed. So there's like an ongoing function related to it. It's not just about waiting for data to come in and then holding on to it and not sharing about what's happening.
Mhm.
So we've spoken about a number of benefits here, right? I've heard a bit about challenges. I want to check in to make sure. Are there any other challenges that people were hoping to highlight before we move to our next question, which really has to do with pandemic-related challenges? I'm looking. Okay, so why don't we
I,
move to that? Oh,
I
go
have
ahead.
one more. I have one
Mhm.
more. I was just in terms of scaling the program really quickly when we were onboarding that many staff, and you're looking at, we were committed to serving 12 families. And without the pandemic in the mix, we were going to spread them out nice across the year and take our time and do that in a way where it didn't strain our resources. But because of certain decisions, we had to scale really quickly, and we compressed it all in one round at our location. And I think many people did, although
I
some
think,
started
yeah.
in the fall. But
Mhm.
that's not just our team and the clinical team. This is like admin, intake, team schedules, because we all have other clients. And so that was a bit of a challenge, but with that added benefit, all the added benefits and the linkages that we had, we were able to push through. And so, with every benefit, there's a challenge, and vice versa. Hmm.
Yeah, I guess I can speak to the opposite side what Melissa is saying, because as a therapist myself, like it was trying to navigate what exactly is my role as responsibility. I need to make sure I'm following the culture and the policy in our agency, but at the same time, I want to make sure what we're doing is fitting the needs of whatever we need to provide to the research team. So it was a little trickier to figure out, especially well, at least for my very first time participating in a research. So it was a little bit difficult in the beginning, but again, we have the best team ever, so it worked out at the end. But it was a little difficult in the beginning, I have to say.
Yeah, and I think that, all the challenges that you speak to, we were very aware of as a research team. And so we wanted to make sure that, again, we weren't interfering with the delivery of the program, and that whatever we did as part of the research protocol was integrated well into what you were already doing, and not adding extra work, because we know everyone's already very busy on top of everything, all the other responsibilities that you have. So you want to make sure that it was, easy on your end, and it wasn't a burden on you to actually do the research program.
Mm-hmm. Yeah, you made it easy, Vivian, and your team.
Yes.
Well, I remember, part from a research perspective, I remember uh, the notion that we wanted to learn about, we approached this from a sense of interest and curiosity about how this would play out with each agency, respecting the agency processes
Yeah.
and contexts, rather than enforcing a particular way that it should play out. So part of the research itself was to learn about what it looks like naturally so in agency kind of settings. But that's also a challenge to do, because we would love to control everything to the point that everything is exactly the same, but flexibility was really the name of the game here,
Oh,
Yeah,
so
and
true.
absolutely.
yeah, it takes more effort. Now, there's obviously the pandemic. This grant, when we wrote the grant, it was pre-pandemic essentially, and when we first had the conversations, it was prior to the pandemic. But when we actually started implementing the program, it was during the pandemic. So we heard a bit about shifting and how this kind of moved to an online mean, and because of the kind of intervention it was possible to shift much of this online and still provide the same activities to kids, and it was still engaging, and you've heard some of that. um, so there were many challenges related to it, or changes related to planning and implementation because of it. One that I wanted to share with everybody here, and then I'd love to hear your thoughts, is a pretty big one from a research perspective. Uh, During the process of actually doing this research, after people have already started to deliver some of the intervention, the Secret Agent Society designers and publishers switched the materials from physical kits that at first Vivian and others were kind of driving around dropping off physical kits to families during the pandemic and leaving it on porches so they could get picked up, and all of those things. But the publishers switched from these physical materials to an entirely digital ecosystem. So it was partly due to the pandemic and the interest in the use of moving things online, so that we didn't have to do that driving around. Everybody could access everything on their computers and iPads. Um, so I'd like you to each think in terms of your roles. What was that change like for you when we switched kind of halfway through, saying we now have this option of going all digital?
Yeah, so. I can start and jump in because I think I was one of the first people to actually know that the SAS program was moving to more digital delivery rather than using the traditional physical kits that we would be delivering to families. And I think one of the first conversations I had with our research team was to decide, well, what should we do? Should we keep with the physical kits? Should we have everyone deliver the digital, the new unused yet digital program? And what would that look like? And ultimately, going back to being flexible and making sure that we didn't interfere with the clinical program at each of the agencies, we actually decided to let the agencies themselves make that decision. So we want to be clear in our and very transparent in terms of what we wanted, and so we had a conversation with the clinical leads and the therapists to let them know that this change was coming before it was announced, that the SAS program was moving to more um, um, digital programming, and that we would leave it up to them to decide what they would like to do, what they were more comfortable with. And actually, what happened was some of our agencies decided to stick with the traditional kits. They didn't want to transition to the digital programming. Some of our groups or some of our agencies decided that they ran one physical or one group with the physical kits, and the next group they wanted to try the digital kits. And then some of the remaining agencies decided to wait to get extra training on the digital kits and to just deliver digital kits for their SAS program. So again, we didn't want to dictate what agencies would do. We wanted to make sure that their staff was comfortable with what they were going to do and how they were going to deliver it. And we were really flexible in that way. And again, it was part of that research question that we had. How does this work? How will this work in the real world, in the community? And so because of that, we wanted to make sure that the agencies themselves made those decisions. So Carmen, I
Yeah,
think I know you were one of the groups that went from physical to digital kits.
We did. We have I guess, luxury. We were in three groups. Two of them were physical kit, and one of them was digital kit. So it was, to be honest, if we were not part of the research, I have a feeling we might just stick with the physical kits. The physical kits group went very, very well, and it's until like, hey, Vivian was saying there's six of digital kits available. We can provide it to you guys. And then we're kind of like, why don't we take this opportunity? And we got the support, kind of going back to what we were saying before, from the whole community and the research team. So we took the leap of faith and it worked out very, very well. But interesting, like Jonathan in the very beginning, the question, one of the very first thought that came into our mind is that teaching social skill online, there's already pushback, even us as therapists, because it's kind of like social skill is an in-person thing. Like, how do you teach this online, right? Like, now thinking back, it's like, okay, that is kind of like not the smartest question, but in the very beginning, it is scary, right? Like trying to figure out how to do it online. But at the same time, I guess, like Melissa, we can speak a little bit to this too, right? The ethical for behavior analysts is that we need to deliver service in a timely manner. Just halfway through last year, knowing that, you know what, this pandemic situation is not going away anytime soon, we need to figure out and adapt. So I don't know, how about you for the pandemic experience? How was it for you guys?
Yeah, I think for us, what came with that is about learning about which families, not just the children, but the parents and their caregivers, are able to still benefit through a telehealth model. So we had to rejig our intake process, learn different ways of assessing that in a more direct way, as instead of just saying, are you okay with doing groups in video? And that meant some of the families were shuffled to get services sooner, where others have waited, and we're just now serving them. Actually, 2 weeks ago, we started our next round of in-person kids, but we're keeping the parents virtual. So we managed it because we needed to, but we also saw it as a great opportunity to learn, because really delivering services in a hybrid model moving forward is truly something that I think will continue for a long time, and for us to really understand who it best works for, and which staff also do better delivering services in that way, was a really cool opportunity that we were able to capitalize on through this.
I think it was, yeah, through, sorry, I think, yes, at the very beginning when COVID started and we really didn't know what was going on, it was definitely a bit of a challenge, and we had to adapt very quickly, especially with the research team. But we were very lucky to have, Melissa, who was able to run some of those early digital sessions with the groups, and we were able to learn from that. And we were then able to then use that information and again share it with the rest of the research team and the agencies, which I think was really helpful in them implementing it themselves, especially if it was new to their agency.
That's right. We did the beta testing for the digital. So we were working through filtering feedback back to catch as many bugs as we could before it got released. So that was a benefit too, where we were able to contribute to supporting everyone, but also get a preview. That's sometimes fun.
Yeah. Oh, I want to add on to what Melissa was saying earlier about the type of participant that I don't want to say selected, that were able to join the SAS online. It's definitely changed because of the technology limitation. We end up having to screen parents and cadets who can use who are able to learn virtually, because some people, like, they're great in person, but virtually may not jive as well for them. And then also, but a very good note that came out from that is we were able to put together a group of families from very different region. They're all over Ontario, And
Yeah, I noticed that.
especially one of the groups, they made friends. I believe, like
Yes.
4 of them are still, yes, right? You guys talk to them in the focus group. Parents would stay as friends. The
Hmm.
cadets, I think they have like a birthday party and they were actually going to each other's events and stuff like that. So it's great. And even the parents were saying, like, if it during the pandemic time, and the reason why these cadets have to join SAS, and we're using the word cadets because that's how we refer to our junior agents. The cadets is that they are having challenges with social skills, so they may not have as many friends to connect with during this lockdown period. But they were able to make a new group of friends that they were getting in touch. They were there to support each other, and parents were super excited, thinking that if it's not because of SAS, not because of the research, not because of the pandemic, they would not have met each other, would not become friends. And we definitely hope they will stay friends forever.
I hope so too. In talking with the families, because we did focus groups with all the parents after they finished the program as well. They noted that, yes, it was during the pandemic, but they were very grateful that you were still able to deliver the program online. And they actually used some of that parent group meetings that they had as a way to, talk about some of the frustrations and some of the shared experiences they had during the pandemic. And it was really important to them. It was something that they weren't getting in other ways because they were in lockdown. They didn't have access to other supports, or they weren't able to meet with other or families and parents. So, kind of a fringe benefit of being able to deliver this program in the community during the pandemic. It was nice to hear that from parents, a little bit of a positive.
Yeah, and certainly we as the research team had to be open to the zigging and zagging around creation of new materials. We might not want to always. The tendency is to stay rigid with, well, this is what we started implementing, so we should keep that throughout. And we see here the kind of some of the indirect benefits of not doing that, of being listening to what people are saying. Now, we have about 3 minutes left in our session. I can't believe how quickly time has flown by. I want to make sure we have kind of one question came up that I want to raise to you all. So in 3 minutes or less, essentially in total, what advice, think about like the one thing you want to convey to the audience. What advice do you have for others who are aiming to carry out and are inspired by this in terms of research, community implementation partnerships?
Mm-hmm. Be flexible. I think that's, to sum everything up in what Melissa has said, what Carmen has said. Be flexible, be adaptable, and from the researcher's perspective, really get to know the community partners that you're working with. Build a relationship, understand their needs, and really use the research to complement their work and not create a barrier.
I'd add that it's really helpful if you can ensure that the organization is fully supporting all the additional resources that you need to tap into. Some ways that people can do that is to lean on the research team to get ideas on how to quote unquote pitch. Being really invested in the project, but there's a lot of additional benefits that come from participating in something like this. And perhaps if it's our first time participating in research, or even presenting, or all of these types of opportunities can come out of it, and being able to really communicate that to your leaders for support is really helpful.
Mm-hmm. Definitely flexibility is big one. I think we all kind of mastered that over the past 1.5 year. And the other thing, communication and working as a team. It's working within your team. Like, I'm very lucky. I got like the best team ever. We connect very well. We're able to deliver the group, as well as the team with the other community partners, as well as the research team. Like, I'm considering this is the whole SAS team, and that, I think that made a difference, how we were able to work together and just be like, the goal is to deliver the best we can to the cadets and their families.
I love that point, because really at the end of the day, that's what this is all about, is us learning about how to deliver the best services to reach the families where they are and meet them, to address their needs, not just what we think is
Right.
helpful for someone to learn, right? And to
Yeah.
learn through those challenges and really capture them together, capture them as you go, so you can look back at them for future opportunities.
Absolutely.
I agree. The thing that just to close is that all of these things take resources. KBHN
Mhm.
providing funding helps us to hire we talked about a research team. There are a number of graduate students, there's postdoctoral fellows, paid staff, all behind the scenes. There were the material resources, the therapist resources. It takes a commitment to provide something like this, but we see the benefits here. So I hope this was really of interest to the audience and they're inspired to undertake their own initiatives. Thank you so much to our panel as we wrap up this presentation. And that's the timing to remind me to say that this session is coming to an end, and it gives me pleasure also to send this back to our host, Jody Carrington. Thank you.
Oh, thank you for that amazing panel, Jonathan, Carmen, Melissa, and Vivian. Such important conversations right now. And I am so excited to see how that program rolls out. I think really watching, kids and families who are blessed by autism to see how they navigate this is just such a beautiful discussion. And I'm so happy to hear it. We're now going to take a 5-minute transition. I'm going to invite you to click the next session while you're waiting for that. You'll see it on the left-hand side is charting a course for infant and early mental health in Canada, reshaping how we think and support mental health in Canada. So you'll see that on your left-hand side in the feed loop. We're going to take this 5 minutes, and I really want you to do that. Get up and get a coffee, move around, check out the gamification prizes to see if any of those are up for the taking in this moment. And then I can't wait for you to sink into this next talk. So take a break, and I will see you back here in 5.